In this lecture, we are going to talk about the tetanus. It is an acute disease which is characterized by muscular rigidity and painful paroxysmal spasms of the muscles. Epidemiological determinants: agent factors, host factors, and environment and social factors. In the agent factors, the causative agent is Clostridium tetani, and the reservoir of infection is soil, dust, intestine of herbivorous. Exotoxin, which is the most lethal toxin. It affects the central nervous system. And period of communicability is, that is, there is no person to person transmission. Host factors: age, it is seen in mostly 5 to 10 40 years, that is active age, and it is seen in newborns known as neonatal tetanus, and it is seen in agricultural workers due to contact with soil. Immunity, when there is a previous immunization, they are immune. Otherwise, there is no agent immune unless they are protected by the previous immunization. Environmental and social factors: unhygienic customs and unhygienic delivery practices leads to tetanus. Mode of transmission is by contamination of wounds with spores. Injury, surgery, and neonates as in unhygienic practices. Incubation period is 6 to 10 days, and clinical manifestations are seen as muscles of face and jaw are affected first, and the first symptom is locked jaw, that is increase in the masseter tone. In neonates, difficulty in feeding is seen. So as the disease progresses, painful muscle spasm leads to descending spastic paralysis, and feet, hand and are spayed, and deep tendon reflexes are exaggerated. Complications seen are rhizus sardonicus, opisthotonous position, and respiratory muscle spasm. What is rhizus sardonicus? It is a sustained spasm of facial muscles that appears to produce the grinning. Opisthotonous position occurs due to the generalized spastic contraction of extensor muscles. And respiratory muscle spasm may cause airway obstruction. Prevention is by immunization, that is TT. It is available as monovalent vaccine and combined vaccine. Combined vaccine as DPT. In children, there are total 7 doses. In the 3 doses of pentavalent vaccine at 6, 10, 14 weeks of birth, followed by 2 booster doses of DPT at 6 to 24 weeks and 5 years, followed by the 2 additional doses of TT at 10 years and 16 years. Next, site. Intramuscularly, it is given at the anterolateral aspect of the thigh in the children and in deltoid in the adults. Prevention after injury. Simultaneous active and passive immunization will be given. It is achieved by cleaning the wound plus monovalent vaccine. And here we see the recommendation for the prevention of tetanus after injury. Immunity category A, B, C and D. Here simple wounds in the category A, that is nothing required, and in other wounds also nothing required. In the category B, toxoid 1 dose, and in other wounds toxoid 1 dose. C, toxoid 1 dose, here toxoid 1 dose plus HTIG. And category D, toxoid complete dose and toxoid complete dose with the HTIG. Okay, that is. The types of tetanus are mainly 5 types: traumatic tetanus, puerperal tetanus, autogenic, idiopathic, and tetanus neonatum. Okay, and the prevention of the neonatal tetanus. Clean delivery practices are required, and training of birth attendants alone can reduce the death due to the neonatal tetanus. Tetanus toxoid will protect both mother and child. According to NIS, 2 doses of tetanus should be given to the pregnant woman between 16 to 36 weeks of pregnancy, allowing an interval of 1 to 2 months between the 2 doses. So, prevention of neonatal tetanus is here. And tetanus is known as 8th day disease because due to the infection of the umbilical stump after the birth, the first symptom being seen about the 7th day. So, it is known as the 8th day disease. This is tetanus. Take the screenshots if you require.